Welcome back, class. Let's continue with our introduction to anatomy and physiology. And whenever we talk about anatomical terms, in terms of referring to a particular part of the body, in healthcare, we have to have a starting position of reference. And that starting position of reference is referred to as anatomical position. What is anatomical position? We see this young lady standing with her feet flat on the floor. She's standing erect with her palms facing anteriorly. Her palms are facing forward or anteriorly. They're forward, they're anterior, and they're also what we call supine. When the palms are facing forward, they're anterior or they're facing supine or forward. Anatomical position, hands are by the side, palms are facing forward, or they're facing anterior or anteriorly, and the hands are also supine, face up. When we see the word supine, it's face up or lying down on your spine. If you're lying on your spine, you are supine. If you're lying on your spine, which is face up, you are supine. But if you're lying face down on your bone, you are prone. The bone being your nose. So if you're lying on your nose or your bone, you are lying prone, which is lying face down. Prone is on the bone, supine is lying on your spine. So when you're on your bone, lying face down, you are prone. When you're lying on your spine, you are supine. That is lying face up, and that is the opposite of prone. When you're lying on your bone, you are prone, which means you're lying face down, and that's the opposite of supine. When you're in anatomical position, you're standing upright with feet flat on the floor, and your hands are facing anterior. So this has also shown up on some past quizzes, and all these terms would be off to the side, and you kind of have to drag and drop them next to the appropriate positioning. Okay? If you understand that, you're golden. You're looking pretty good. So now we move on to other terms that are important to know. So when we're looking at the head right here, and we look at this part of your skull right there, which we would typically say is the person's forehead. But of course, in anatomy and physiology, we have to use more sophisticated, complex terms. So we're going to call it frontal. It's the frontal region. So when we do osteology and you learn about the frontal bone, you'll have an idea where it is. When we do muscles and we learn about the frontalis muscle, you'll have an idea where it is because you know frontal is up here. When we do the chin is called mental. So when we do osteology and we learn about these two holes in this bone called the mental foramen, just because you know the chin is mental, you have an idea where the mental foramen are, or the holes in the chin. When we look at the cheek, it's buccal. So when we do a muscle called the buccinator, you'll have an idea where that is. The mouth is called oral. We'll do a muscle around the lips called orbicularis oris, orbicularis oris, so oris, oral, sounds the same. When we look at the nose, also when we talk about the chin, it's mental. Not only is there the mental foramen, but there's a muscle called the mentalis. Mentalis, so again, chin. When we look at the nose, we call it nasal. So there's a nasal septum in the center. There's a nasalis muscle, right? So understanding these terms only help you with other anatomy. When we look at the skull, it's cranial. So we have cranial bones to go over. When we look at the face, we'll do facial bones. There's facial bones and cranial bones. When we look at all of this combined, we call it cephalic. Cephalic means head. My wife is from a Greek island called Cephalonia. Cephalonia comes from cephalad, which means head. It's the head Greek island on the Ionian seaside. Cephalad. Someone can have, if you've ever heard of the term, encephalitis, right? Inflammation of the head, inflammation of the brain, encephalitis in the head, the brain. Ear is otic, eye is ocular, or sometimes called orbital. The neck is cervical. We happen to have 7 cervical vertebrae in the neck. The armpit is called axillary. So when we do the axillary artery, axillary nerve, axillary lymph node, you'll have an idea where it is. The arm is called brachium or brachial. So when we do muscles like brachialis, biceps brachii, right? You'll have an idea where they are. In front of the elbow is antecubital. The belly button is umbilical. The abdomen is abdominal. The breast is called mammary. And the chest is called thoracic. And all of those combined is referred to as the trunk or the torso. Thoracic is also the thoracic spine, where we have 12 thoracic vertebrae. And that's when you hear thoracic vertebrae as T1 to T12. The T for thoracic, and you have 12 of them, T1 to T12. In the neck and the cervical, we have C1 to C7. So if someone fractured their C2, you know it's the second cervical vertebrae. But you have 7 cervical vertebrae, C1 to C7. So this has shown up in the past on some of the McGraw-Hill quizzes in the past. And again, you'll have the terms off to the side, and it's a drag and drop. So this part is the frontal region. The eye is orbital or ocular. The nose is nasal. The chin is mental. The cheek is buccal for buccinator. The ear is otic. Now we're left with lateral cervical triangle and anterior cervical triangle. Now, even if you didn't know what they were and we had to best guess, anterior means it's in the front and lateral means it's lateral, it's off to the side. And usually within the body, we do have triangles and they're bordered by muscle and bone. Okay, so there's a lateral cervical triangle and an anterior cervical triangle. You can see the sternocleidomastoid muscles here, which are going to be part of the border. Okay, let's look at the lower half of the body, look at some of the terms. Brachium was the arm, whereas the forearm is the antebrachial. That's the forearm. The wrist is called carpal. You've heard of someone that has carpal tunnel syndrome. So there are 8 little bones in the wrist called carpals. Not to be confused with tarsals in the foot. So at the ankle, we have tarsals, and at the wrist, we have carpals. Just remember you drive a car with your hand on the steering wheel. You drive a car, you need your hand to carpals. Think of tarsals with the T, with toes. So the tarsals are in the feet, the carpals are in the hand. The palm is called palmar, whereas in the foot, it's called plantar. The bottom of the foot is plantar, so the foot is planted on the ground, plantar, but the palm is palmar. The digits of the fingers are called phalanges, and thank goodness the digits of the toes are also called phalanges. The thumb is digit 1, The pointer is digit 2. The birdie or middle finger is digit 3. The ring is digit 4, and the pinky is digit 5. The same thing is true for the toes. The great toe is 1, 2, 3, 4. The pinky would be 5. So the most medial toe, the one closest to midline of the body, that's medial. That's the first digit. And the more lateral toe is the 5th digit. The most medial finger, because remember, in anatomical position, the palms are facing forward, is the 5th digit, and the most lateral finger is the first, being the thumb. Okay, so it's opposite what we had of the foot. The thumb is called pollex, whereas the great toe is called hallux. Pollex is the thumb, hallux is the great toe. Just remember the H in hallux with heel, and the P in pollex is for palm. So they just kind of like associating the names a little bit. The foot is referred to as the pedal foundation, just like the word pedal, pedal. The thigh is called femoral. Well, the longest bone in the body is the femur, right there, the femur. The pubis is called pubic. We have 2 pubic bones in here. And then where we have the inguinal ligament, that's the groin, is inguinal. Now, everything that we're looking at here in the front is anterior. Everything on the back would be posterior. So anterior and posterior are opposites. When you're looking at someone from the front, it's anterior view. When you're looking at someone from the back side, it's the posterior view. So here in this picture, we're looking at the posterior view. The head is cephalic. The neck is cervical. How many cervical vertebrae are there? 7. So you have 7 cervical, 12 thoracic, and then in the lumbar spine, you have 5. So how do you remember how many vertebrae are in different parts of the spine? Well, you eat at 7 a.m., 12 noon, and 5 p.m. You eat at 7, 12, and 5. Cervical, thoracic, lumbar. 7 cervical, 12 thoracic, 5 lumbar. Altogether, you have 24 movable vertebrae. 24 movable vertebrae. The highest part of the shoulder is acromial. The back of the elbow, olecranon or olecranal. And the back is called dorsal. So dorsal and posterior are interchangeable because they both mean back. Just think of a dorsal fin of a shark. It's on its back. Dorsal. So the lower back is called the lumbar, and we said there's 5 lumbar vertebrae. The rump itself is called gluteal. So when we do muscles and we learn about gluteus maximus, gluteus medius, gluteus minimus, you'll know where the gluteal region is. The back of the knee is called popliteal, whereas the front of the knee is called patella. So the patella is the kneecap. The patella is the kneecap, whereas popliteal is the back of the knee. It's posterior view, popliteal. The calf is sural. The heel is calcaneal. If you've ever heard of a runner who has a calcaneal heel spur, these are runners that get these sharp, bony extensions called spurs, and every time they walk and their heel hits the ground, they have extreme pain, so calcaneal heel spurs are off the calcaneal bone. The calcaneal bone happens to be one of the tarsal bones. There are 7 tarsal bones. There are 8 carpal bones. So one of the tarsal bones is the calcaneus. The bottom of the foot or the sole of the foot is the plantar surface. When we look at a body as a whole, when we move upwards, we're moving superiorly. When we're moving down, we're moving inferiorly. But when we're looking at the extremities, whether it be the upper extremity or the lower extremity, we don't use superior and inferior. When we're talking about these body parts, we use the word proximal and distal. Proximal is closer to the beginning of the torso, and distal is more distant. It's further away, whether it's the upper or the lower extremity. Proximal is towards the beginning, like to approximate. Distal is more distant. Okay? So if I start here and I'm moving in this direction, we would say I'm moving proximally. If I start here and I'm moving towards the wrist, I'm moving distally. If I'm up here at the proximal femur and I move down towards the patella, which is the kneecap, I move distally. If I start at the patella and I move up to the head of the femur, I'm moving proximally. If I'm at the patella and I move down to the tarsals, I move distally. If I'm at the tarsals and I move to the hallux, I move distally. If I'm at the fifth digit and I move to the first digit, I move laterally. If I'm at the first digit and I move towards the fifth digit, I move medially. So whenever I'm moving towards midline of the body, I'm moving medially. When I'm moving away from midline, I'm moving laterally. So the nose is medial. If I want to move from the nose to the ears, I'm moving laterally. If we're moving from the umbilical to the flanks, I'm moving laterally. If I'm moving from the pelvic bone here and I'm moving to the pubic bone, I have to move medially, midline. When I'm in the back of the body and I'm moving towards the front, I'm moving anteriorly. If I'm in the front and I'm moving towards the back, I'm moving posteriorly. The other name for posterior is also dorsal, just like the dorsal fin of a shark. The other term for anterior are the ventral region. Ventral is anterior. Superior and inferior is in reference to the entire body as a whole. When I'm talking about just the trunk in the center, moving towards the head, I'm moving cranially. Moving towards the tail, I'm moving caudally. Caudal means tail. So caudal, cranial. Good place for our next break. When we come back, I'm going to cover a topic called quadrants, regions, and planes. Quadrants, regions, and planes.